Thank you. Thank you. Good afternoon, ladies and gentlemen. Today I'm going to talk to you about our MOVE tool and its introduction. So it's a critical care early progressive mobility protocol. Just want to give you a bit of background as to our hospital. I work at the Golden Jubilee National Hospital in Clydebank, and we are home to the regional and national heart and lung services in the west of Scotland. We are a national waiting time centre, and we receive patients from health boards across Scotland and more recently some Irish patients as well. And we carry out approximately 1,400 major heart surgery procedures every year. Now, all patients who attend our hospital for cardiac surgery will see a physiotherapist after their operation. Our gold standard routine post-op physio pathway is 4 days. Data from April 2014 to April 2015 showed that approximately 24% of our patients followed this routine pathway. 66% of the patients had an extended pathway between, over 5 days to 10 days, and 10% of the patients actually had a complex recovery post-operatively of greater than 10 days in critical care. Just want to give you an insight into a couple of service developments that we've had that are relevant to this. Back in 2011, we introduced our physiotherapy milestones within the team for two main reasons. One was to help with the education of newly qualified Band 5 physiotherapists in terms of goal setting and building their confidence in terms of rehabilitating patients within the intensive care unit, and also to evaluate our patient progress within critical care. More recently, in 2014, saw the introduction of our 7-day service within the rehabilitation department. Historically, we still did cover a 7 days Saturday-Sunday service, but it was only a respiratory service. The introduction of our new 7-day service means that we actually continue a rehabilitation of a longer-term patients at the weekend, which is a massive benefit. So this is our initial physiotherapy milestones we introduced back in 2011. So if there's any physios in the room, they'll probably seem quite standard, but it was for any patients in ICU longer than 72 hours, and the milestone started from sitting over the edge of the bed, progressing to static and dynamic sitting balance, sitting up in a high back chair, progress to stand, and progress in mobility. And one of the important things we wanted to know was if the patient wasn't achieving it, why not? And obviously we wanted to know what the outcome for the patient was as well. Now, these milestones were working well for the physio team. However, what we realised was that the wider MDT and our weekend physio staff weren't familiar with these physio milestones. So we decided we wanted to introduce a new tool that would improve the continuity of physio progress over the 7 days, improve our communication amongst the MDT, but also formalise a standard documentation of our early progressive mobilisation with the patients. To do this, the team lead physiotherapist collaborated with one of our consultant anaesthetists. The physiotherapy milestones that you saw on the screen remained, but we decided to add in extra medical and physio dimensions to them. We drafted a first copy of this protocol, and I carried out a test of change within critical care. However, I'd like to point out that this, when I say critical care, this is only our longer-term ICU unit that this is in currently. We trialled the protocol and reviewed it with the MDT and within our physio team, and then we made some amendments, and the final version was implemented. And this is what we've got currently. So you can see it's certainly more comprehensive than our initial one. Obviously, the top section was what the medical side that the anaesthetist wanted to introduce, so we've got quite a standard protocol for the patients that are suitable to mobilise. If they fit the MOVE category, they move on to the section at the bottom, which is a lot more comprehensive from just the 5 stages that we saw before. So it's a numbered and lettered programme, so going from assisted bed exercises right up to walking independently. This protocol is being used to document and communicate patient progression in critical care for 100% of patients with a prolonged critical care stay of 72 hours. We now have this MOVE chart displayed in all patient rooms in our longer-term ICU, and we also had our MOVE chart section added to the MDT daily goal sheet, so section at the bottom. So what we would do is we would assess the patient and decide, first of all, do they fit the MOVE category, yes or no? If no, why not? we would look at the mobility level currently and what we would aim to achieve that day. If the patient didn't achieve for any reason, we would write down so the MDT would know straight away why the patient wasn't progressing. So our early progressive mobility protocol has been adopted throughout critical care, and we have noticed that there is improved MDT communication, quite often now noticing that surgeons are quite aware of how the patients are doing. Anaesthetists will actively engage with the patients and know how they're doing with their rehab without coming to speak to the physios first, because it's documented clearly. And we now have a standardisation of patient progression using these physio milestones. Our next step, so one of them has actually been changed already. Back in February, rather than having the paper system now, we've had a move section added onto our electronic system, which is a lot easier in terms of writing your notes. It's in one place rather than extra bits of paper. We're going to audit the use of the move tool. Rather than the daily goal sheet, this will be its use on the electronic system. We'll re-evaluate and review the move tool in another 6 months' time and gain some more feedback from our staff regarding the progression of patients. So do they think that our milestones are achievable and the order is appropriate? Thank you very much.